Hi everyone, my name is Eli Wallace and I'll be presenting over SARS. So, what is SARS? SARS is a acronym that stands for Severe Acute Respiratory Syndrome. SARS is a group 4 virus, meaning that it is positive for single-stranded RNA. This also means that when the virus injects its genetic material into the host cell, DNA is not created and or used as an intermediary to create more RNA for protein synthesis and other genetic material. So the RNA is just used directly for protein synthesis. It comes from the family of coronavirus. It comes from the family coronavirus. It's related to two other uh, coronaviruses that have been identified to cause the common cold. It's also related to MERS-CoV, which is another type of coronavirus that's also a severe respiratory illness that had a recent outbreak as of 2015. The SARS virus is actually one of the largest RNA viruses known. It's 29,000 nucleotides long, so it's a fairly large RNA virus. RNA, as of in October of 2012, the CDC classified SARS as a selective agent. And what that means is that SARS is a very harmful virus to human life. It has the potential to kill thousands. And so here the picture it's just a picture of the SARS virus. You can see how it's an enveloped virus. So you have here the glycoproteins, and then here's the RNA, and then here are the spike proteins. And this is just a electron microscopy picture of a healthy cell being infected by the SARS virus. So quickly, this is a pathogenesis of SARS. So SARS really binds to cells that express ACE2 on their surface. So what is ACE2? ACE2 stands for angiotensin converting enzyme number 2. It's really found on the surface of both endothelial and epithelial cells. Now, in studies, they found that while endothelial and epithelial cells both express ACE2 in about the same amount of quantity, they found that endothelial cells had much lower rates of infection than epithelial cells, and they wondered why. And so they did some more research, and they found that the SARS virus is actually dependent upon a proteolytic enzyme by the name of cathepsin L. Cathepsin L, like I said, it's a proteolytic enzyme that's also expressed by epithelial cells. And what they found is that for some reason, cathepsin L is a part of the binding process for the SARS-CoV into SARS-CoV for SARS-CoV to the host cell. So epithelial cells will express ACE2 and cathepsin L in high quantities, while endothelial cells of the same type, the same organ really, will show lower signs of cathepsin L expression. Now, these other two receptors that I've named here, surface protein L sign and surface protein DC sign, these are considered to be alternate receptors for the SARS virus. The SARS virus typically the SARS virus will infect cells that have these receptors on it. The L sign is really found in the liver and lymph nodes, and DC stands for dendritic cells. So you see DC sign on dendritic cells and some macrophages, and you see L sign particularly on some types of liver and lymph cells. But those are alternate receptors. So typically, SARS is really going to attack and infect cells that really express ACE2. So a lot of research was done after the 2003 outbreak, and interestingly, they found that both structural and non-structural components of the SARS virus will actually be caught in the serum or medium of the person infected, and what they found was that these particles will actually induce apoptosis of healthy cells. The mechanism behind this is not really well known. as far as the studies have shown. They just showed that for some reason these particles will induce apoptosis. Now, immune cell infection is also tied into chemokine and cytokine expression, and they found that the SARS virus has the potential to infect immune cells, both the innate and the adaptive system. And what they found was that destruction and killing of these lymphocytes and leukocytes actually would help upregulate it would really upregulate the expression of chemokines and cytokines, especially really these chematic cytokines, ones that are able to destroy pathogens or destroy cells or damage cells. And they believe that this is actually one of the reasons why there's so much damage within the lungs, is that there's such a release of these chemokines um, that this actually caused damage to not only the virus but really to the infected cells and actually normal healthy cells. I think actually this was the outbreak. This was the outbreak that the term cytokine storm was coined. So this is actually the virus that it was. This is the first virus that that term was used for. Age and sex are both contributing factors for pathogenesis. Of course, the older you get, the higher, the older you are, the more likely you are to be infected from SARS. And of course, the older you are, the more likely you are to die. Unfortunately, in one study, they found that the oldest age group had a mortality rate of 46%, while the youngest age group had only a mortality of 3%. So it's varying. The strength of the infection is really dependent upon age. There are also other contributing factors to mortality. Um, they found also that males, in the exact same study, they found that males would actually have higher rates of mortality than females, and this was never understood. It was just a phenomenon that was noticed. Um, there are also several other sort of cofactors SARS infection. This really includes something. This includes like if you have some sort of cardiac disease, if you have a pulmonary disease of some sort. Diabetes is also linked to higher rates of infection of SARS, and this is sort of also normal for infections. This is sort of typical if you have some sort of pre-existing condition that makes it harder for your body to fight off pathogens. You will likely become infected. Actually, yeah, that's just a picture. Okay, so you can't really talk about pathogenesis without pathology. And so these are really the main organs infected, and they've seen it in really almost all autopsies conducted for SARS patients. They found that these are really the main organs affected um, by the SARS virus, particularly the lungs. The lungs, because before SARS was officially identified, SARS was described as a atypical pneumonia, and normally when we think of pneumonia, we sort of think, maybe some sort of fluid buildup in the lungs, and you're unable to clear it. But in this case, it was determined pneumonia really because of the straightforward damage this SARS patients have in the lungs. So you also see damage in the liver, the kidneys, and you also see a lot of, in autopsies of a lot of SARS patients, spleen, there was a lot of damage in the spleen and lymphoid organs, particularly lymph nodes. This again is of course because the SARS virus, as I mentioned earlier, has the potential to infect immune cells, particularly circulating immune cells. So this could be neutrophils, and so in these neutrophils may have burst in the actual germinal. It may have burst in the spleen or the actual lymph node, and those cells may have infected neighboring cells. So you would see a lot of damage in the spleen and the lungs. And gastrointestinal tract, lymphoid organs, those are also seen as well. So here's a lung X-ray of a person with SARS, and you can see that this is day 5 and this is day 15 here. So day 5, day 10, day 13, day 15. You can see that as time progresses, the lungs become more opaque in color. And that's pretty significant considering that by day 13, the lungs are very opaque and almost really hard to see directly. They're not very clear at all whatsoever. But however, the virus has an incubation period of about 2 to 7 days. It could be up to 10 days, but the infection can last for well over a month. And in fact, it's recommended that if you are infected with the SARS virus, you should really not leave your house until you've been able to, until your really sort of breathing abilities have been sort of restored. So you can't really talk about SARS without, of course, talking about the 2003 outbreak. It originated in the southern Guangdong province of China, highlighted here. So it originally began in 2002 with farmers, and the outbreak really, however, took off when one of these doctors who treated one of these patients in the province attended a wedding at an international hotel in Hong Kong, and he stayed on the ninth floor. And of course, he infected several others on the floor, and those people also traveled back to their places of residence or returned home, and they infected other people. So SARS was transmitted to 25 other countries, um, including the US and Canada. However, the US saw no deaths. Canada did see, I forget how many. I can't, the numbers for the Canadian infection are hard to come by, but there are well over 200 cases confirmed. Toronto was the epicenter of the disease. So there were over 8,000 SARS cases reported over a year and a half. So the outbreak lasted from about 2000, officially from 2002 to 2000, to July 2003. So it lasts about 6 months, it lasts about 10 months here. So there's 25 other, so 8,000 cases of SARS, 774 deaths. There's a detailed timeline on the WHO website, the WHO. And this is a picture here of this. The green highlighted room is this doctor who treated some of those patients in that area, and you can see he infected a lot of people on this floor. And I think actually everyone who's infected on this floor actually did pass away, unfortunately, from the disease. And that's the end of my slideshow. So thanks for watching.